Hi, you're watching DNA Today, a multi-award winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor and your host. What does it really take to move the needle on health equity for rare diseases, especially on Capitol Hill? In this episode, we're joined by Jenifer Waldrop, Executive Director of the Rare Disease Diversity Coalition, as we're going to refer to it as RDDC, I'm sure, during the interview. Under her leadership, the coalition is tackling systematic inequities across the rare disease journey, from timely diagnosis to clinical trial access, treatment development, and sustained care. With partnerships across biotech, government, and patient advocacy groups, RDDC is reshaping the policy landscape to ensure historically underrepresented communities are not left behind. Right now, we're capturing Jenifer's insider perspective on advocacy strategies, legislative process, and how every member of the rare disease community, including you that are listening right now, can engage in meaningful change. Thank you, Jenifer, so much for coming on. I'm excited to dive into this because we've certainly talked about rare disease advocacy and giving advice, especially to parents and caregivers that are involved in this, but I don't think in over the 350 episodes, we've actually done an episode dedicated on how to do this. So thank you so much for coming on and letting me pick your brain.
Oh, thank you. Thanks so much for inviting me so I can represent the RDDC in your audience and amongst your library. And wow, congratulations on 300 plus episodes.
Thank you. Yeah, we've been going for a lot of years. It's like every time I say it, I'm like, wow, in a couple of weeks, we'll hit 13 years of the show. And I'm like, wow, my baby is a teenager now. So Jenifer, I figured we'd start with the big picture. Why was the Rare Disease Diversity Coalition created? What gaps did you and others see that you were like, we need to help fill this in the rare disease community and advocacy? What is the mission that you're always striving to accomplish?
Oh, yes, absolutely. So I think maybe I can share a little bit of the history and the startup of the Rare Disease Diversity Coalition. The Rare Disease Diversity Coalition, RDDC, is a part of a larger organization that's been around for 42 years. It's called the Black Women's Health Imperative. The Black Women's Health Imperative, if you think about Black women's health 40 years ago, it was in a very different place than it is today. There are still some things that obviously that it's really important to the Black women community and how things are happening with them here in the United States in terms of healthcare, and we still carry some of the programs forward from 40 years ago. And what I mean by that is if you think about Black women's health, you think about how they were being treated when it comes to pregnancy. How are they talking to their doctors about concerns with their periods, for example. And now, from a Black woman's perspective, and even just in general, we talk more about menopause in the 20-25 years than I think we've had in the past. So all of those programs are very, very specific, both to just women in general, but also there's some nuances and differences that Black women face in this country. And so the Black Women's Imperative has created some programs and some education and some groups to help the Black women specifically as they are women. In addition, if you think about how Black women were treated in the 80s, for example, with HIV. So for those that actually were in those lived experiences, but of course there's history books too. When we first had HIV globally, and then here in the United States, there was also a difference in the care for Black women. And so we continue to have that conversation around HIV too for our community. So fast forward to about 7 or 8 years ago, the then president of the Black Women's Health Imperative looked around and said, what else perhaps we could add to our portfolio for helping either the Black women or the underserved populations? And recognizing that organizations like the National Organization for Rare Disorders, NORD, who was super instrumental in passing the Orphan Drug Act in 1983, they had not had a super focus on health equity. So when we looked at some of the other organizations that have been around for a while, also focused on rare diseases, there was also a lack of umbrella organizations that would be focused on the underserved, underrepresented populations. So the president of the Black Women's Health Imperative, who's an epidemiologist, and using her studies and her knowledge, looked around and checked in with, like you mentioned, biotech companies, government groups, patient advocacies, to see if a coalition like this would be relevant in our society. And sure enough, everyone said yes, and that they would also be interested in being either key stakeholders, constituents, volunteers, committee members, etc. So that, back in May of 2020, started the coalition itself. So after the research was done, the coalition officially kicked off in May of 2020. From there, we continued to do some organizing, and we held our first event in February of 2021, which is Rare Disease Day in February 2021. That being said, actually, I was not a part of all of that. I've been in this role since October of 2022. And that being said, I've been able to then take the initial founders' ideas and folks that help establish the purpose of our mission, which is to actually narrow and eliminate maybe perhaps the disparities that underrepresented populations in the rare disease community face. But more importantly, rare disease patients should be treated just like any other patients, should have shorter delays in diagnosis, hopefully like other folks that are living with preventable or ongoing chronic diseases, for example. So our mission is very clear and it's very lofty, that we want to be able to provide and have a world where the rare disease community, especially those from the audience and the populations that we specifically serve, will not be faced with the barriers to care and access, and will have a better standard of care than they are currently receiving.
And it's great that RDDC focuses on these health disparities that can uniquely impact the rare disease community, because I've done many, many episodes about rare diseases, and I don't often hear of organizations that have this focus of the intersection between rare diseases and other underrepresented groups coming together. What are some of the health disparities that you think about that affects rare diseases compared to other areas of healthcare that can be compounded by also being a minority in another way? Because you've mentioned this concept. Is there a few that come to mind?
Oh, yes, there are certainly a few that...
Probably more than a few.
Yes. And we could probably spend a whole hour discussing the rare disease community from these other populations that you mentioned, like the underrepresented, marginalized populations, because in itself, by definition, there's going to be disparities or difference in their healthcare. So one, when it comes to rare disease patients or persons living with rare diseases, oftentimes because they are in that category of rare, they will need to work with a specialist. And that specialist may or may not be local to them. And so if they are so fortunate to actually be diagnosed with their disease and it's considered a rare disease, then they need to find somebody that is a provider, a clinic, a group that can actually help support them mitigate some of their symptoms so that they can live and thrive with this particular disease. So you have the access and you have the location and geography. That's one issue for rare disease patients. Now, if you think about the rural population, again, by the nature of the definition of rural, it's not as highly populated, which also means the facilities are not as great or as vast as they might be in a city setting, for example. And so a rural population in a state, if the specialist or the treatment center is in that same state, then it's a slight burden on them, or maybe a greater burden on them if they need to get from their home in the countryside essentially into a city. So time and cost may be associated with that. So that's a health disparity in itself. If you think about the way that our United States healthcare system has treated Black and Brown populations, I'm thinking specifically like the Tuskegee tests, that has impacted the trust and the information that the people in the Black and Brown communities share amongst each other. And when you have a rare disease and you think about maybe testing, if you're so fortunate to be a part of clinical trials, you may be a little bit more reserved to do so, knowing that you know about the Tuskegee tests, for example. So you have this type of information based on our own history and based on our current lived experiences that create these health disparities for the rare disease patients. And when we think about the marginalized, underserved populations, we have a pretty broad definition of diversity that includes, like I mentioned, the rural population. It also includes the race, the minority race and ethnicity, which currently is Black and Brown populations, for example, Hispanic populations, people of color that's non-white, for example. It also includes the LGBTQ community as part of our underserved diversity populations and those that are in the lower social economic status. So those are the areas, to your point, that RDDC is providing a voice and advocating for.
I love that it's not just one area of diversity that you're focused on, but really looking at so many different ways of defining that, to be inclusive and have these considerations for other groups. As many listeners know, I'm in the queer community, so it's interesting to hear, like, well, how can that impact care for rare diseases? And part of what I wanted to have you on the show for as well is to explore how we can advocate. And I think part of that is being able to engage with partnerships, with communities. I've seen that RDDC partners with biotech leaders like Amgen, which has been one of our sponsors. So shout out to them. So how does that work when you partner with big biotech leaders like Amgen compared to when you partner with more grassroots organizations, or, that must look very different, probably similar goals, but a different way to approach this. I'm thinking about the parents, caregivers that are in the early stages, maybe of starting nonprofits for their kiddos' rare disease, and people in similar situations. Can you share some insight on just how these partnerships work?
Sure, absolutely. So I'm so glad you mentioned Amgen. And actually, when we think about, we also have a relationship with Amgen. They were one of our sponsors for our Capitol Hill briefing this year. As one of the sponsors for our Capitol Hill briefing, they had a chance to also help us identify speakers that would be a part of the briefing. And they connected us with a patient that actually is living with a type of vasculitis. And this patient also lives in more of a Republican state. And she identifies in the LGBTQ community, and she is married to a woman. That being said, during her treatment period, she was actually not treated the same way that a straight person might be treated in the hospital setting, meaning that her wife came to visit her, obviously in the hospital, and wanted to find out what the process is, what's going on with the care, how is she doing, and they wouldn't really answer her. They didn't want her to be in the room, so they didn't treat her like a family member, but rather as an other. And we all know that if you're treated as an other, it's obviously not inclusive, and it's not the best care for the patient. So I bring up Amgen is because I would not have met this person if it was not for the relationship with Amgen and their focus area. And in the same time, when I think about this patient, because she's living with vasculitis, and she's thriving, by the way, she has her own patient advocacy organization. And so she is also a part of our coalition now. So she's been able to help us with actually a paper that we're working on, sponsored by Amgen, on vasculitis when it comes to both the rare disease, but also through the lens of health equity. So taking a little bit of maybe a different spin than what some folks have seen in the vasculitis space. So we're providing some patient recommendations for those living with vasculitis. And this volunteer and advocate is providing her voice, which has been so eye-opening and really important. And because she has her own small advocacy organization, I love how this question is kind of killing two birds with one stone through Amgen. She has found her voice. She's found a way to position her work. She's found strength in telling her story, and finding different opportunities, both written, so things like social media posts, writing to her congressional leaders, as well as just vocalizing it and being on Capitol Hill on the federal level.
That's
so
huge.
It is huge. I love how that one event that we put on has legs to it. And I think that when it comes to advocacy, to your point, everything we do matters, and you never know how it might create a multiplier or ripple effect. And I recently saw this advocate again after the Capitol Hill briefing, and she's really enjoying being a part of a coalition. And exactly what I expressed to you, she expressed to me as well.
Yeah. And that's so important that when nonprofits work with big biotech companies, sometimes pharma companies like Amgen, you end up having this huge network, and they might have key opinion leaders like this person you're referring to that's a patient advocate, and being able to connect you, and then you see where that relationship goes. And you're beautifully highlighting the importance of including people with the condition or caregivers of someone with the condition to be part of the process. Because for me, as a healthcare provider, I'm also a genetic counselor, I have a certain perspective. But in many ways, most times, talking to a patient advocate is actually going to be more helpful than talking to me because I don't have a lived experience. Although some of that resonated with me in terms of, oh, when you're the partner and you're in some kind of healthcare setting and they're like, oh, who are you? And you're treated as another, like I've certainly been there. So, that struck a chord with me. But I think just so important to be including patients in this process and having them be partners in not just research, as we've talked about on the show, but just in the advocacy process, and very much included with nonprofits like you've been mentioning.
Yes, absolutely. And so I applaud the Amgens and the other biotech and pharma companies that do have a focus on patient advocates, getting the patient working or connecting with people that are living with the disease that they are doing their research on. So that those folks that are doing the research are not living in a bubble or working in a bubble. So 100% that congratulations to those groups. And for those groups that aren't doing it, I think that they really need to think about how they should be doing it. And, the question becomes, how do they get started? Maybe they can go to umbrella organizations like the Rare Disease Diversity Coalition to learn perhaps if there are people living with the rare disease that they are focused on. With 10,000 rare diseases, we don't have 10,000 different patient advocacy organizations, but we do have ones that maybe are more in a general space. So I mentioned vasculitis. So there is a vasculitis foundation, for example. But this other advocate, she has a very specific vasculitis disease. And so she created her own patient advocacy organization that's named after her particular vasculitis. So you have a number of those groups that are examples. And so those folks that belong to those types of organizations, they really are hungry and very interested in partnering with those that are doing the research.
Yeah. And I think taking what we've learned from research and all these other projects to then lead to, hey, we want to talk to people in power, like on Capitol Hill, to say, hey, this is what's going on and this is why you should support this bill. So this can be in many different ways. And this is where I'm really, really interested of what you have to say, Jenifer, because RDDC introduced a health equity bill I learned about when we were chatting earlier. And I'm wondering, with this experience of working with a representative, how does this go? So if you hear of a bill that for people listening that maybe their nonprofit would like to support, how do they get started of like, yeah, we would like to fly or drive to Capitol Hill and set up appointments and convince people? Where does someone even begin?
Sure. So I would say a few different ways, right? So one is for RDDC, we actually have a lobbying firm. And so we're partnered with another organization that is allowed to do quite a bit of lobbying. So we have Black Women's Health Imperative doesn't have the IRS code to do the full lobbying. So we need to work with another organization that does. And this organization has lots of relationships with congressional leaders. They've had it for decades. They've hired people that are done with their political career, and now they're acting as analysts and advisors inside the actual firm itself. So they have a lot of street cred, right, when it comes to relationships with federal Capitol Hill folks. And I'm pretty sure they've got a lot of different relationships within the different states as well. So this work was not done overnight, and it wasn't done alone for RDDC. We put together a concept of a bill a few years ago, and we have, working with my advocacy firm, we were shopping around for it. And so we went to a number of different congressional leaders and to see if they would be interested in bringing this act forward. I have to actually give nods to the staffer of the Herd Act, who is now sponsored by Marilyn Strickland. She's the one that actually brought it to Representative Strickland's attention and said, this has been sitting in your docket and in your files for a while now. Why don't we do something with this?
The
And that
staffers are very important. I've gone to Capitol Hill once with a rare disease group, and we work for health, shout out. But I've also done a lot of things like on Zoom that the National Society of Genetic Counselors is saying, hey, genetic counselors, you should support this and everything. And that's how you get your foot in the door.
absolutely. And because my contact who works with the firm has a great relationship with the staffer, he was able to continue to follow up with that conversation with her. And all of a sudden, I got an email. I knew we were working on it, but it took a couple of years. It said that she would want to be in the 119th Congress. She's ready to bring this forward. And as you all know on this call, when it comes to bills, they are done in certain orders. So there's a reason why HR, that big, beautiful bill that some people like to call it, is number one. That was the first one for the 119th Congress. Well, this one is HR 50. So it's the 1,700 bill. This Herd Act, it was released on February 27th of 2025, which was the day before Rare Disease Day. And so this beautiful bill that we've created is focused on is health equity and rare diseases. And what that does is we've put some things in there around establishing a scholarship and a loan repayment program, perhaps, for healthcare professionals that are going to serve in the rare disease patients. So as you mentioned earlier, there are disparities and differences in the way that rare disease patients are identified and are treated because when doctors, providers, and others go through schooling, there is not a whole curriculum and course load just dedicated to rare diseases. And if they're so lucky to have some rare disease classes, they're not going to get all the information that they need to identify the symptoms for 10,000 rare diseases.
No, if anything, it's sometimes here and there a sub bullet on a slide. Yeah.
Absolutely. And then a couple other things that are important in the Herd Act is thinking about our position with the health equity and disparities area. If we think about our tribal and native health centers, we want to be able to provide grants to those that are maybe perhaps doing research in those for those communities as well, because we know biology makes a difference. And so we need to be able to do the research on all people so that the effectiveness of the therapy is available for all people as well. So we have something in there around grants, encouraging folks to go into that space and do the research with the Native and Tribal Health Centers. We also have another one that you might be interested in the Herd Act, because these acts, can be pretty long, is the interest in strengthening interagency activities, which means if you think about clinical trials, you think about the data collection, you think about the early detection screening, are they all working together? Are they doing it in a way that enhances the quality of the life for the rare disease patients? And so one of the comments that we have in there is to try and ensure that the agencies and the different folks that are working together are working on the project are doing it together and in tandem. And that's really important because when you think about folks that are the small population of the rare disease community, you want to be able to keep them throughout the entire trial research process. And then you also, once hopefully the research goes well, and then the drug gets approved, for example, then you want them to be the advocates and the speakers and the ambassadors, et cetera, for that particular drug. So the interagency activities and that connection points is really, really important. And it's just another piece of our complicated healthcare system. And so we found some of these gaps and we put that into the Herd Act, just to give you an idea of what's in the act itself.
Yeah. And as you've explained really well of just knowing the proposed bill so that when you are talking to people, of not just me as like a journalist, but when you are talking to people on Capitol Hill or other types of policymakers, you're able to break it down for them like you have here of, okay, what would this bill do? Why do we need it? Seems to be the important parts. Do you have other advice for people that maybe they have been able to work with a lobbying firm, they've set up appointments with staffers either on Zoom or in person on Capitol Hill, and they're preparing for these meetings? What advice would you give them other than what you have so far, just in terms of what should they be focused on? Who should they bring with them? So I'm thinking patient advocates, genetic counselor, other healthcare providers. How have you practiced for these and prepared?
Yeah, so it's interesting. In the current role that I have, I've been able to spend quite a bit of time on the federal level on the Capitol Hill. But I do believe that my tips and my advice and the stories here apply to both the state level as well as on that federal level.
Thank you for pointing that out. It's not all Capitol Hill in DC. Yes.
Exactly, exactly. And I also want to recognize in this administration, it's been encouraged that we work with more of our state leaders, perhaps then maybe depending on what your goals are, what you're trying to do, and the actions and the achievements you're trying to make during this current administration. So folks are advising that if you're really trying to show a strong concrete outcome or deliverable, that you work with your state representatives to be able to do that for the near term, for example. But either way, to your point, I think let's start with exactly what you're saying. Who should you bring to these conversations? One, I would say definitely bring any kind of specialists that is focused on your particular rare disease, for example. So if you do have geneticists, you do have providers, you have other patient advocacy organizations that are not necessarily the patient themselves, bring them in that community to the appointment, to the meeting. Through and through, both in my previous companies that I've worked for like 15 years ago, as well as more today, the politicians love and want to hear the stories of the lived experiences of the American people, essentially. I mean, essentially, they, at the bottom line, I've heard from both Republicans as Democrats say this, that the stories that are the human stories are what is why they do what they do. And they want to be able to understand why they should either pass an act or a bill or support something.
Storytelling is so powerful. I mean, I've seen that just within podcasting, obviously, but that's how you grab people's attention and they'll remember a story versus just throwing isolated facts that are concerning maybe and really highlighting what you're trying to say, but weaving facts into stories like, hey, here is this story about this kiddo with a rare disease, and then be like, and think about there's this many people that have a story like this. And weaving it that way, I've seen be really powerful and effective.
Absolutely. I would also caution, though, when it comes to the story and the amount of time that you have with the congressional member or the staffer, for example, keep your story succinct, impactful, and to maybe perhaps just a couple of minutes. Again, it seems like this is the test of time, that this has been trained upon me years ago, and it continues to be the tips that most people provide. Go ahead and provide your stories, but do it in a short way. And actually, it's okay to share a leave behind if you're doing this in person as opposed to on a Zoom call. Go ahead and print out the documents and send it over and leave it with them. And everything that I've done on the Hill, the folks have been receptive to the leave behinds as well. Another piece I would say is, in terms of maybe some new folks being on the Hill, is bring your own voice to the Hill in the way that is most meaningful for you. So, like, yes, be professional, but also know that you can tell your story in an emotional way. So perhaps don't cry while you're telling your story, but definitely show the emotions, show the pain, describe the situation, and especially if you believe that there is a disparity or an issue there that can be addressed or should be addressed, bring that forward as well.
Yeah, I think that's fantastic advice. And yeah, these meetings can be very quick. I remember, my first couple, I was like, oh, that was it? Yeah, sometimes you're talking minutes. Yeah, it's not like it's a full half hour meeting.
For sure. And then for your own self, because Hill work can be intimidated. I remember when I first started this many moons ago, I remember being trained and getting these tips that I've been giving you all. But don't be intimidated. They have seen, staffers and members have seen all kinds of patients, especially in the rare disease community, especially those that are living with different diseases. They've seen them both from a difference in the physical as well as the speaking perspective. So don't be intimidated. And if you don't have the best vocabulary or word choice, that's okay. We know in this country that education runs the gamut from an array of different folks that have maybe multisyllabic word choices to those that are very simple and barely past elementary school. So don't be intimidated from wherever you are. We really do need rare disease patients and advocates to share their voice, whether it's they're doing it in person or they're doing it online, because the rare disease community is so unique and so special, and it's actually much obviously smaller than other advocacy groups, that every voice counts.
Yeah, very well said, Jenifer. Well, thank you so much for coming on the show and sharing your insight and highlighting all of the wonderful work that RDDC has been doing and all this advice for people that are looking to advocate for legislation and in all of these different capacities. I think it's just so helpful for people to be able to listen to this as they prepare, or maybe just to give them a little confidence. Maybe they're on a flight or a train or a drive to Capitol Hill right now, or their state representatives, and they're listening to this to give them a confidence boost. And I think you've succeeded in helping them do that. So thank you so much, Jenifer. And we'll make sure to link to a lot of different resources in the show notes specifically for RDDC. But thank you so much, Jenifer, for coming on, taking the time to share all of your wisdom with us.
Thank you so much. I really do hope that the listeners do get something out of the information that I've had to share. We exist because we do believe that we are in a unique place, and so that we can help other groups think through the rare disease community and then the historically marginalized populations. So as a coalition, I welcome more members to join us, more funders to participate with us. And so, as you said in the show notes, feel free to contact us so that this is not just a one and done, but let's continue to do this together.
Yes, that's a good theme. It's like you start something and then you just keep working it through. Sounds great. We will put all of that info in the show notes. Thank you, Jenifer.
Thank you so much.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.